What do you want the intro to be like?
What do you want?
You just like finger the air right there. You wanna sha. I don't know what to do. Besides, everybody, welcome to Standby for Tones Medical and our YouTube series. Today we're going to talk about the 2 and 10 rule, the 2 minutes of hell, and 10 minutes of afterwards. So let's get into it. What is the 2 minutes of hell? What we're going to talk about is what we can do as life-saving procedures in midst of some of the crappiest patient situations you possibly can be in, whether that be a witness cardiac arrest, witness trauma arrest, pre-arrival trauma arrest, all of the things. What can we get done in 2 minutes, and then how do we take care of that patient for 10 minutes after we get our return to spontaneous circulation before we try and move them again? Let's get into it. The 2 minutes, we have to start thinking of things that are reversible. This comes down to old school ACLS, okay? But there's a lot of things in the H's and T's that we can't fix. We can't fix the hydrogen ion acidosis right off the bat. We can't fix the hypothermia right off the bat. We can't fix it fast, at least. So we need to focus on things like tension pneumothorax. We need to focus on things like airway and early defibrillation, and then getting to our CPR, especially in our trauma resuscitation patients. There are a lot of agencies out there now that don't even start CPR on their trauma resuscitation patients until they have an ET tube, bilateral holes in their chest, so bilateral finger thoracotomy or chest tubes. And they have to have IV access and everything ready to go. They get 2 minutes to get everything done that they possibly can before they start their CPR on their trauma arrest. They get their blood going. If it's a neurogenic patient, they start to get their hypertonic saline on and moving. There's so many things that we can get done as two providers in 2 minutes that will improve our patient's outcome drastically. So after that, we get our 2 minutes of hell out of the way, whether it's trauma or medical. Pick your 2 minutes. What are your biggest battles that you need to overcome in those 2 minutes? Whether it's getting your access, your intubation, your chest decompression, anything big like that out of the way in 2 minutes. But what happens when we get ROSC? What do most EMS providers do? They pick up and they run. They scoop and they run. They feel a pulse. They freak out. They run. What we need to start focusing on is after that 2 minutes of hell, we get into the 10 minutes of relaxation, okay? Our 2 and 10 rule. 2 minutes of hell, 10 minutes of post-arrest care. You need to spend 10 minutes, and I challenge you guys to take 10 minutes as soon as you get that ROSC to slow down. This is your time to get your stuff together. This is your time to get all of your vital signs. This is a great time to fine-tune all your vent settings. Make sure that we're running the minute ventilation that we need to, because minute ventilation is life. Get your patient's blood pressure from 60 over death up into something of like 100 systolic or 90 systolic. Get their MAP into a perfusing state. Anything above 65 is great. Get their heart rate under control. Give them their atropine. Get your vasopressors started. We're going to talk to our family. We're going to make sure that we have all of the information correct, whether it's traumatic in nature, so talking to a bystander, talking to family who watched the patient go into arrest, whatever it may be. You're going to finalize your story. You're going to get all of your medicated drips going, whether that's your amiodarone infusion for a post-VFib, VTAC arrest, that's your Levophed, that's your dopamine, that's your vasopressin, that's your whatever other medication that you can think of, your push-dose epi, you can do your push-dose vasopressin, all of your medications that you feel like you need to use in a resuscitative patient. This is the time to get those going, because it is far harder to mix them and get them going when you're on the road than you may normally think. You have more hands-on scene. You have maybe some help you could delegate this task to somebody. You could say, hey, I need you to mix this with this. I need 4 milligrams of Levophed in this bag of D5, and hopefully it'll get mixed for you. I mean, we always do our checkbacks and verifications, but you have hands to be able to help you do it, instead of it's just either yourself in the back of that ambulance or you and your partner trying to battle and get through everything. There's so many things that we can be doing in this 10 minutes before we move them, because we got to remember that 10 minutes, our patient is more susceptible to going into a reoccurring arrest, whether that goes back into a VFib, VTAC arrest, whether that is a persistent normal sinus into asystole because the patient needs blood, or they're in neurogenic shock and they're herniating and they need hypertonic saline. We really have to start learning how to fine tune our 10 minutes of post-arrest care to make sure that we take care of our patient to the best of our abilities. Other things that we can tag on top of that, we can get all of our cables, we can get all of our ECG, EKG machines, anything, your Zoll, your LifePak, whatever you use. You can take that time to get it all set up. You can acquire a good clean 12 lead that's not bumping down the road. So you have something to tell to your STEMI coordinator down the line at the hospital about what's going on if this is a post-arrest going to the cath lab. You have your times to get your IOs secured, your lines secured, to get them packaged neatly on your stretcher before you start heading down the road. Really, this 10 minutes of care comes into a huge player of not only for your patient's well-being, but for your well-being and being able to effectively take care of them at that time. So there you have it. There's our 2 minutes of hell and our 10 minutes of post-resuscitative care broken down into less than 15 minutes. Thank you guys so much, and we'll see you on the next one. 5 minutes? Broken down in 5 minutes. We'll do one of those.
One of these things.
Yeah. Point at 'em.